You're listening to the MotherToBaby Podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of three, Chris Stallman.
Welcome to another episode of the MotherToBaby Podcast. I am Chris Stallman, and as you may know, I'm a mom. It says in our intro that I'm a mom of three. I'm actually now a mom of four, and I will not be a mom of five, just in case you were wondering. We're done with that, but I'm also a genetic counselor and a teratogen information specialist. And what that means is I give information to patients and providers about exposures during pregnancy, during breastfeeding, before pregnancy, or in cases of adoption. And a teratogen can be anything that you come in contact with during pregnancy. So it could be something like a medication, it could be alcohol, it could be smoking, or a lot of different things. And that's what we focus on here on the podcast. Today, for example, we're going to be talking about medications related to IBD. So stay tuned for that. But before we get started, I just wanted to mention that MotherToBaby is a nonprofit organization and that we do give information through telephone, text, chat, or email. And you can find all of this information on how to contact us and more, including information about our studies and our fact sheets on our website, which is MotherToBaby.org. Today, we have Beth Kiernan from MotherToBaby California as our guest expert and here to fill us in on information about IBD and medications related to IBD. So, Beth, how are you today?
I'm doing pretty well. It's an interesting time. I have a full house. All of my kids are home.
Wow.
And, we transitioned to working from home, and it's been different than anything else I've ever experienced professionally, but very rewarding in a lot of ways, too.
Yeah, there is that old proverb, may you live in interesting times. I'm kind of over that. for now, I kind of am. So tell me about the age ranges of your children.
So I have a almost 29-year-old, and he and his wife had their first baby in December.
Oh, congratulations.
And that was really exciting. Thanks. And that was just really fun. And then I have a 21-year-old, 19, and 17.
So my eldest is 21, and he is on the opposite coast from me. So he is staying safe, but is a little bit scary at this time. But right now in the house, we have my daughter, age 16, who just got her learner's permit. And we have my 2-year-old and our 4-month-old. So, yeah. Interesting is the nicest way to put it. A full crazy house. And I'm sure we are two of millions of parents, guardians, who can say the exact same thing, that it's an interesting time and things are a little bit crazy. So Beth, thank you for being on the show. And we do have a caller on the line ready to ask some questions. Her name is Amber, and she herself has a podcast. It's called About IBD, so About Inflammatory Bowel Disease. And she is going to tell us a little bit about that, but also ask us some questions about pregnancy and the medications that are used for IBD. So let's go to Amber. Amber, how are you today?
Hi, Chris. I'm doing really well. Thanks so much for having me on.
Oh, it's our pleasure to have you on the show today. So would you mind telling the audience a little bit about yourself?
I would not mind at all. My name is Amber Tresca. I was diagnosed with ulcerative colitis many years ago when I was 16 years old. I subsequently had surgery to treat the ulcerative colitis, and now I live with a J-pouch. I have 2 kids. They were both born after I had my surgeries, so I had my kids when I had my J-pouch, and it was an interesting time. My oldest is going to be 13, my youngest is 10, and it was really kind of strange because there wasn't a lot out there to sort of help me navigate what it was like to be pregnant and then to breastfeed with IBD. So Now there's so much more information, and I'm really glad to be working with you all and be on your podcast and talk about how we can better support mothers who live with IBD.
So let's talk for a second about your podcast. What is the topic? What do you talk about?
My podcast is called About IBD because it is literally just all about IBD.
Nice.
And so I primarily speak to patients and then also to caregivers and to healthcare professionals. And the topics range from anything to dating, to then motherhood, to how you can work better with your physicians, to what it's like to be a minority and to live with IBD and how that all ties in together. And so I just try to gather all of the different patient experiences of people who live with IBD and to put them out into the universe so that not only for the IBD community to better understand each other, but then for people outside of the IBD community to understand what the IBD patient experience is like.
Wow, that sounds amazing. Are so many, you got firing off things that you're talking about. I'm like, oh, that's cool. Oh, that's cool. Oh, I've never heard that before. That's really neat. Do you find it, I mean, I think I know the answer, but I'd like to have your opinion too. Do you find it fun? Is it rewarding also?
It has been so rewarding. I've been doing it for 3 years, and I joke because I started it originally because I got a little upset about sometimes research stories come out that say things like, oh, the cure for IBD has found. And I'm sure that this happens with a lot of different diseases, but it just so happens that, IBD is where I'm focused. And so one of those stories came out, and I'm telling you, it was sent to me, I don't know how many times, and I got a little upset, and I was like, okay, we need to talk about this. And so I literally sat down with a microphone and just, blurted out all of my thoughts about how research works and things like that. And I put that out into the world. And then the next week I got mad about something else. And so and then, I started asking other people to come on my show and to give their experiences. And in the beginning, I felt very nervous about asking people that I didn't have a personal connection to. So I was primarily asking with people in the IBD community that I had worked with in the past or that I personally knew. And almost every time I'll ask them to relate their story to me, they will tell me an aspect of their journey that I didn't know, even though we're close and we know each other and all of this. So it really started bringing out so many different facets, and that has been incredibly rewarding. And I've discovered that I right now we're all recording obviously remotely because we have to, and I do a lot of remote recording, but in person is my absolute favorite, to sit across the table from someone and hear their story and dig deeper into it and then understand what they've learned from their disease.
I agree. I get the opportunity to talk to so many people like yourself, people who I almost never see because we do most of it remotely. I'm in one place and you're in another, but there's so many things I never even thought about, and so many things I never would think about because we're not experts in everything. We're not expected to be, or we shouldn't be expected to be. And just to have a different perspective, I think, sort of changes your world a little bit too. We're all in this together. That's, everybody's sort of slogan now because the world has changed somewhat. But I think it's so interesting too, not to forget that, besides the pandemic and whatever's going on with us in that regard, you still have things to deal with every day, and I still have things to deal with every day. So I think that keeping that awareness kind of adds a little bit to our normalcy.
It does, and it's been so interesting that I think most people probably realize that as a content creator, you have a editorial calendar and you have things scheduled and you're going along. And then we were all at in a stay-at-home order. And then I started thinking about the different ways that IBD intersects with what we're all dealing with right now. Mm-hmm. So that completely took over my editorial calendar. So for the past several weeks, I've been looking into the idea of how IBD intersects with COVID and SARS-CoV-2. And I've been exploring that, talking to patients who've recovered from the disease, talking to healthcare providers about how we can live with it, and prepare, and what we should be doing, and then telehealth and all of this. So it's really been an interesting couple of months, and it certainly has brought me onto new topics that I never would have thought of before.
That is really cool. COVID-19, I think, is going to end up having some interesting things come out of it. And I think part of it is like what you're saying, when people who have certain conditions, if they get it, if they're at risk for it, how do they get through it? What happens in the after? And so I think it's going to be a learning experience. I'm not saying that it's a great thing to happen by any means, but I think that we can get some knowledge out of this.
I think I'm not really a silver linings type of a person, but I think there are things that we're learning and things that are going to come from this. The first thing that comes to my mind is normalizing telehealth, which is a real boon for people that live with IBD. So that's one thing that I'm hoping is going to become more normalized as we start to come out of this and start going back to modified future, whatever it looks like, that I don't even know yet.
Yeah, I think we're all in the balance here, and it's amazing how many people were able to get their telehealth up and running. I think that's an incredible thing, and I hope to see that progress into the future. So
yeah, I agree.
Let's get down to the nitty gritty. I'm here asking you all the questions when it's supposed to be the other way around. The world is upside down right now, so if you will forgive me.
Yeah.
Oh, okay, so what questions do you have for us?
Women with IBD have a lot of questions, primarily about their medications when they get pregnant. And so one of the questions that we get a lot, and when I say we, I mean myself as part of a group called IBD Moms. That's myself and Brooke Abbott. And we have created a space for pregnant people and for mothers to be able to talk about anything having to do with motherhood. And so a lot of the questions that we get are about, what do I do about my IBD medications when I get pregnant? Because often women don't know what to do, especially in those first few weeks when they might not be getting some kind of guidance from their healthcare professionals right away.
That is an excellent question, and one I'm sure that can have multiple answers. But Beth, do you want to take a crack at that one?
Yeah, once you find out that you're pregnant, there can be a delay of some weeks before you actually see a healthcare provider, and that was before this pandemic. So there's a time period where women are kind of struggling to find some good sources of information. And if you've been pregnant before, you may have fewer questions, but if you've never been pregnant, or if you have some new things arise, you may have indeed some important questions that need to be answered. So, it's exciting. It's a little bit jarring when you first find out that you're pregnant. And if you were able to plan ahead for your pregnancy, then hopefully you've had a chance to ask your OB and your gastroenterologist for some advice about your medications. So the most important goal in pregnancy for a woman with IBD is that she stay in remission, or as close to it as possible. And that's important because it can help avoid complications like pregnancy loss and poor growth of the fetus. But this isn't the time to sacrifice your own health for the pregnancy. So getting these answers is going to be really important. And keeping you healthy likely involves taking some kind of prescription. But keep in mind that about a half to maybe 70% of pregnant women take at least one prescription. So let me go back to the planned or not planned pregnancy. If this pregnancy is a surprise for you, and that happens to nearly half of women in the US, then we would recommend two things. Calling MotherToBaby gets you good quality information. You could also call your doctor's office. You don't need an in-office appointment to ask these really important first questions. What we all usually do first is not what we recommend, and that is taking a deep dive into the internet to do your research. That can just be completely overwhelming and sometimes scary. So when you call MotherToBaby, we will share with you a summary of information about your medications. And we gather that from various databases, from articles that are published in peer-reviewed journals, kind of put that summary together for you so that you don't have to look in so many places online. And we're looking at studies where women have taken these medications during pregnancy. We will share with you whatever we can find, whatever we know about risks for miscarriage, risks for birth defects, any sort of pregnancy complications like preeclampsia or growth problems in the baby. If there's long-term data on baby's development after birth, we'll certainly share that with you, and any other specifics that are related to that drug.
So, Beth, in part, what I took from that is I should not be running to Dr. Google.
Yes, that's exactly right.
Okay. And I tell you, I'll be the first one to admit it. I'm guilty of that. You know, something happens. I'm just like, oh, let me just Google that symptom. And no, that is absolutely not what we're recommending. And if I may add on something too, you know, like you said, in those first couple weeks, you may not be able to get a face-to-face appointment. And certainly now with how the world is going, but in most cases, the recommendation right off the bat is going to be to not make changes to your medication until you speak to your healthcare provider. And that way, if they do, they may not want you to change. They may want you to change, but that's something that really shouldn't be done without their guidance.
That's correct.
So, Beth, I know it's really hard to say in particular about a medication unless we know which one we're talking about, because there's several and, you know, there can be different things to consider for each medication. But I'd like to take a step back and talk about what happens or what could happen. What are the risks if a woman has IBD and is not taking her medication or is not well controlled during pregnancy? Are there risks to the pregnancy if that's the case?
There is some data to suggest that, yes, if a woman goes off her medication and flares, she increases risks for pregnancy loss and for preeclampsia and for other kinds of problems that go hand in hand with being pregnant and having an autoimmune condition. So that's the strategy behind controlling this disease as well as possible. We have fact sheets on different medications that are used to treat Crohn's and colitis. The concern is if a woman stops her medications, that she could flare. And then depending on how long she's off her medication, some people who try to go back on those don't have as strong a response to those medications later on down the line. I think we don't have good research about this to tell us how long you could be off your chosen prescription that's worked really well for you, and then expect good response when you return to it. So I'll speak with women who find out they're pregnant, are uncomfortable staying on a medication, want to go off of it until the pregnancy is completed and they're finished breastfeeding. That could be a year or longer than a year. And trying then to go back onto that same medication may not be successful. It may not work as well, and they may need to switch to a different medication, which then means they have to go back to their doctor, get approval from insurance if they have that, try a new medication, and all of that takes time, during which they may be flaring and be very uncomfortable.
And Beth, you know, I've gotten some of these questions as well, certainly not as many as I know that you and your colleagues get out in California. But what I've been hearing is that some of the questions that are coming up now is, well, this medication, whatever one they're taking for their condition, may suppress the immune system, so make it harder to fight off infections. And of course, you know, we're in the middle of a global pandemic, and it's very concerning. And so some of the questions that are coming up is, should I stay on this medication, not just for my own health, but in terms of IBD, but is it somehow going to change my health in terms of catching something like COVID-19? Are you all getting those questions as well?
I haven't gotten too many, but I definitely have heard that those questions are being asked of gastroenterologists and other specialists. The concern with not taking medication as I understand it, is that then a woman risks having an IBD flare, and that, depending on its severity, could land her in the hospital. This is not the time that any of us wants to be in the hospital.
Mm-hmm.
So I would refer women back to their specialists to address this question, and say that until and if your doctor recommends that you stop, it's probably better to continue the medication.
I think this is a good example of the classic risk versus benefits. We know that there is nothing in the world that is risk-free. However, there are other things that are riskier, and there's a lot going on right now. So I agree with you completely. I think that this really needs to be one conversation, or in some cases several ongoing conversations between a woman and her healthcare team, just to make sure that she and baby are doing as well as possible throughout pregnancy and then afterwards.
That's exactly right. I think it's really important for women with IBD to create that team, to be sure that the OB is in touch with a gastroenterologist. She might want to see a maternal fetal medicine specialist early in her pregnancy for consultation. That is the team, and you want your team with you, making decisions about medications with you until delivery.
So this was a great initial discussion, and Beth, thank you so much for being on the show. I would like to invite you back for next time to talk about breastfeeding and IBD and medications.
Thank you. I'd be happy to do that.
Excellent. Thank you. And before you go, I'd also like to ask if you wanted to say something about the studies that Mother2Baby are conducting.
Sure. So Mother2Baby has several studies that are actively enrolling women with Crohn's or colitis who are taking some specific medications indicated to treat those conditions. We also enroll women with Crohn's and colitis who are not taking those medications. And so we would encourage women to call us, or they can complete a form online at our website, MotherToBaby.org. When you fill out that form, one of our screening team members will call you to ask some questions to determine which study you might qualify for, and then we'll schedule your enrollment. These are all observational studies. They're not clinical trials. That means that we don't ask women to take a particular study drug or to stop taking their medications or change their medications in any way. The other thing that's nice, especially now, is that you can participate in our studies from the comfort of your own home. We do our interviews by phone, by Zoom if you live in Canada. No travel is required.
Excellent. Thank you, Beth, and we will talk to you again next time. And actually, we're going to bring back Amber next time as well to discuss breastfeeding and IBD and medications. You can find us, as always, on your favorite podcast catcher. So we're on Spotify, we're on iTunes, or however you listen to podcasts. You can also subscribe so that way you never miss a new episode, or you can always go back and listen to previous episodes. And if you have a question in the meantime, you can contact us as well. So if you have a question about the podcast, if there's something that you want to hear on the podcast, or if you want to participate in the podcast, we would love to hear from you. So you can email us at contactus@mothertobaby.org. And if you have a question about an exposure during pregnancy or breastfeeding, before pregnancy or adoption, you can reach us in a bunch of different ways. So of course, you can always call us toll free at 866-626-6847. You can reach us by text at 855-999-3525. And you can also find us on our website at MotherToBaby.org. So once again, signing off, this is Chris Stallman. Thank you so much for being with us today. We hope you will join us again in the future. And remember, Mother2Baby is here for you. Take care.
Mother2Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother2Baby, please visit MotherToBaby.org.